Welcome back to the Dr. E Show. For those of you who are tuning in for the first time, I'm Dr. Uyawene. I'm a medical doctor and I specialize in psychiatry. And for this segment, we will be talking about how the coronavirus affects the brain itself. But before I move on, I want to remind you to subscribe and check out my other videos in this channel as well. So there's this question of how coronavirus is affecting the body, all the major organ systems. But from what you may have been hearing people report, it is clear that the brain does get involved. Before you freak out and before you start getting scared about the illness itself, I want to put it out there that the medical research currently shows that it's a subset of patients who get this coronavirus illness that will have neurological symptoms that show that the brain is involved. So not everybody gets it, but a smaller percentage of people get it. And these tend to be people who have a more severe course of illness. So you may be asking, well, what are these symptoms anyhow? Many of the symptoms that show that the brain is involved are several. They are headaches, drowsiness. Some people will note that they have a change in their level of consciousness. So they might feel like they're disoriented, not sure what day it is or where they are or what things are. They may feel delirious. And in some pretty extreme cases, you might even find someone may be comatose. Some people are reporting a loss of smell. Some people report a loss of taste. In some cases, you might see seizures as well, and any kind of paralysis will also fall under neurological symptoms. And that brings us to our next question, which you might be thinking, so how does this even happen in the first place? Well, there's several ways the brain can get involved with the coronavirus illness. Although there are multiple ways, I'm going to just focus on three. The first one being direct involvement, so direct injury from the coronavirus illness. But before I move on, I just want to lay the foundation that the brain and the spinal cord form what we call the central nervous system. Now that's important because the central nervous system is made up of neurons, which are in essence brain cells, or what we would call nerves. So in terms of the coronavirus illness affecting the bodily systems, it will affect the individual from the outside, from the periphery. And what it does is through the peripheral nervous system, it gets into the central nervous system and can actually invade the brain cells through this system. The second way it can affect the brain is what we call hypoxic injury. So what is hypoxia? Hypoxia is a big word for saying your body doesn't have enough oxygen. Now this is pretty important because why is this key? This is key because your body needs oxygen, but especially your brain cells. Now, in terms of hypoxia, how the lung functions is when you breathe in air, the tissues and the cells in your lungs, which is what we call alveoli, take the air and do what we call a gas exchange. So it pulls out the oxygen from the air and it pushes out carbon dioxide and other gases you no longer need in your body. This way, your body can keep up and keep abreast with the amount of oxygen it needs. In the case of the coronavirus illness, the virus itself affects the lung cells, making it difficult for that alveoli to make that gas exchange. And so because that is difficult, the amount of oxygen the lungs are able to pull out from the air is decreased. Now that's a problem because if your body doesn't have enough oxygen just in general, everything is deficient in oxygen, but especially your brain cells. And your brain cells need oxygen to survive. So that in of itself can begin to damage brain cells. Now, secondly, aside from the brain cells getting damaged from the reduction of oxygen in your body, it can also have other downstream effects, particularly what we call acid accumulation. And now this can lead to a whole host of other things I will not necessarily get into, but it can lead to edema and swelling in your brain. So this, as you can see, is how the brain could be involved, maybe not directly, but sort of a secondary effect from the respiratory system getting affected. And the third way this can also happen is what we call immune injury. So now when the virus gets into your body launches an attack on it. So your immune system, in essence, fights the virus. Now you want it to be an appropriate amount of attack by your body. But if this response is too much, then you can have the chemicals which your body are releasing become detrimental to itself, including the brain cells. I hope this was helpful. Don't forget to like it and share it. Till next time.